This is my first time here. Let me state that it is great to be here, and it's not only the hotel that makes me feel great, it's also the crowd that makes me feel great. Thanks for having me here. As Chris stated, I am someone who is in between the commercial side and the research side. We have a research institute of about 450 people, Plus, which is in the Netherlands. So on the other hand, and there's about 30 spin-outs around that, and we create a number of them every year. So we're right in the middle of trying to do something with all the research. So the sensitivity is both ways, especially the position I am in. And I'm also involved with Mansef, which is one of those not-for-profit organizations that tries to support that kind of issue. Especially Mansef tries to support governments, industries, and academia to understand how to speed up the commercialization curve, how to speed up the uptake of technologies if they mean anything in everyday life and could translate into useful products. One of the things we've been seeing is, nanotechnology is just a way to make things, and it basically works with materials on the one side and advanced materials, and on the other side it works with devices and systems. And the extreme part there, of course, is the semiconductor industry, which is a highway in its own. Then there is a whole set of new equipments and products that people foresee that will be very difficult to make because they're so complicated and they involve many things, and I'll go into that. But in the middle ground, there's something extra that is not a material, not a system, or maybe it's both. It's something like a cell-like thing. And in the targeted drug delivery issues, you see that coming back. It is a distributed thing of a whole number of little things that do something functional for you. So they're more than just a material. They have a functionality, but at the same time, you need a lot of them to do something for you. It's like a cell, like a bacteria type. And that's what a sort of a middle ground between systems and materials. I'll touch upon that a little bit. We've been talking about this. I add micro, and why do I add micro? Well, one of the things is that a lot of micro enables nanotechnology research, but on the other hand, if we want to look at what can happen with products, there is a number of micro products that sort of give us a feel how these might work in these environments. So the company examples I give are more micro examples than nano examples. That's why I put them in, to get a feel for how these things work. Of course, miniaturization is interesting. Basically, I'd always say technology is not important, it's just a way to make things. So technology really, should be outside of your view. You don't need the box, you just need the function. That's what you're looking for as a consumer. Nanotech adds to miniaturization with new phenomena, new production paradigms. Then you have the other thing, you're in a lab, and typically it takes 20 years from idea to really buying something off the shelf in a shop. And there's virtuous and disruptive elements to that process. Some of the processes will be taken up by existing industries. For instance, semiconductor industry needs some certain things to keep their curve going up. The same goes for pharmaceutical industry. But on the other hand, you have the disruptive things that are trying to change the paradigm of today's industries, which are very hard to bring in. Then you have the problem of nanotechnology, which is very different from the typical of the example of semiconductors. That it's, in semiconductors, you have a unit cell, a transistor, or maybe even a chip layout. That is something that the whole system focuses on, and then that total layout is used in various markets. You can make a chip a little bit different for a television, for a handset, and et cetera, et cetera. That enables a lot of cross-learning in the industry down there. Because what you find here, you can use over there too, because they're all making transistors in various ways. In nanotechnology, there is a big difference between a material enforced by carbon nanotubes and some sort of a biomedical device sensing proteins or something. There's nothing that, only the very deep science is shared, not up to a half product level. So there you go. Miniaturization in itself is very relevant in the medical area. This is an example of that pill that people, I've been looking at this with great interest, because one of the things I would never want to get into touch with is these endoscopes. Every morning I stand up and, no, not that. So these guys are just getting shrinking existing technology, bringing it together. It's more of an integration effort than anything else. The level of miniaturization today enables this to be done. But then, as a product itself, technologically, it doesn't look very disruptive, but it is disruptive in the medical market. Even this, because the doctors don't know how it works. And it's a little bit different from the endoscopes, because the endoscopes, you can pull in and pull out. And these things go with their own pace. You can do a little bit about the pace, not too much. And then there is the whole regulation issue and the standardization issue. Nothing is there. So it disrupts a whole industry of endoscopes. But on the other hand, there is a market pull. And that's the nice thing about medicine, is that the market pull is, you can make it visible very, very well. So I've been talking a little bit about micro and nano, and it's after lunch, so I thought I'd put this in. We've been talking about dust mites. And these are some from University of Wisconsin, from Sandia National Labs in the States. And everybody had been showing ants and mites with little gadgets in their paws and they all look great, because look at how small things we can make. Great. And then we had Dave Williams, a researcher from Sandia, talk over at our place, and I used his slide. He said, well, dust mite, even smaller. But, this looks neat, but this looks even neater, because it has a lot more functionality than this mechanical little issue. It can find its own energy source, get rid of its, waste products. It can repair itself to a certain extent. Incredible. And at their labs, there was a discussion going on. Does it even show higher functions like communication? And there was a big discussion, but they didn't have to do any real experiments to show if it could communicate, because one of the researchers stood up and says, well, it can communicate because it can multiply itself. And if you can multiply yourself looking like that, you can surely communicate. So there you go. Health drivers. Why are people looking for innovations in health? Well, that's clear. There's a large number of them. We just want to feel good. We want to feel healthy, wellness. There's a trend towards enhancement that's creeping in already. I mean, people have been doing that over the ages, but this technology further enables this. There's the personalized health. You need to know a lot about the subcell level, the protein composition of your body, to understand what drug works or what drug doesn't work. Then there is the aging population. There is preventive healthcare, which links in with food, by the way, for a large part. There is the cost of a healthy society. There's what else put there, gene pool issues. Our gene pool is changing in a way. One of the issues there is that when we were created, only 1 in 4, 1 in 3, 4, 5 kids reached the productive age. Now, 98% reaches the productive. So something is changing in the quality of our system, over the long run. Then there's some indirect. So there's a lot of drivers in there that ask for solutions. And if you look at micro and nanotechnology, it's very clear that it can contribute to these solutions. One of them is that you move towards the level, I mean the size level of the processes of life. The processes that take place within the cell, and the cell basically is the business unit of life, as I always call it, organs being the holdings or something like that. And so you can look at and work with cell surfaces, the cell dynamics in there. There's about 100,000 proteins that seem to make up a cell. I'm a mathematician physicist, so I always say, well, about 100,000, I don't know. I don't know if anyone knows, but cell dynamics, there's so much going on in there, and you want to know. It's a very complicated machine. And disease processes, or the process of pharmaceutics, are very complicated. And everything is attached to everything within that cell. So what is going on in there? You need to understand more. Another interesting issue is that when you go into this area, you align with the production paradigm of nature itself. So you're much better able to create something that works together with your body instead of just staying in there. A titanium oxide coated knee replacement or something like that. So, but there is one issue, and I think we touched upon that a number of times today. One issue that I think we can't solve as nanotechnologists, and maybe this is even an interesting issue for a upcoming FTF event. Complexity and massive parallelism of cells, of the society, of software or information issues That's an enormously difficult area where we don't have skills enough to master that. So, miniaturization is one of the things that nanotechnology brings to that table. Surface modification. Creating surfaces that exactly, because surfaces interact. That's the place where stuff interacts with the living tissue. So surface modification is a very important aspect. Imaging, showing details, invasive, non-invasive, microscopically, or through radiation patterns. Materials, basically looking at single molecules or very little amounts of molecules, tracing or making the onset of a disease visible at a very early stage when the first proteins come into the bloodstream. So that's a lot of relevant technological advances. And when you map them onto what might happen in various areas that have to do with health, it's all over the place. What we saw with nano in general, it's the same for the medicine area. The pharma is looking for better ways to drug discovery, massive parallel screening of drugs, but also looking at what happens within the cell, looking at what the drug does within the cell, understanding the process, not just the end effect, it works or it doesn't, understanding the process. There's diagnosis issues, I'll go into that a little, imaging, surgical prostheses, etc., etc. Well, there is at this moment a European technology platform, a sort of an agendizing platform that tries to get grip on the whole thing. You might miss prostheses in there, don't know why it's not in there, the rest is in there. So I'll go through those a little bit, just to give a bit of flavor to the whole thing. So diagnostics and imaging, making something visible, preferably on the level of single or few molecules, so you can see what's happening in a living system. Another issue that's already there for a part and is coming in more is that you have point of care diagnostics and stuff like that. So you don't have to go to the lab all the time. Your doctor in the hospital or even at your home brings the lab to you. Massive parallel detection. There's about 100,000 proteins in your body, and balances between those, or the existence of some proteins and not others, tells you something about the shape you're in. So if you have massive parallel detection, you can map certain disease patterns across what you see in those balances, and you can do a lot of triage-like screening of persons. You don't go to the house doctor anymore, you just have that chip and it tells you to go to the specialist directly because probably this is what's going wrong with you. Then the whole issue of opening up the cell to understand the process of the disease and to more targetedly address those issues with a drug. At the moment, it's sort of, you have a whole set of chemicals, you just try until you find a good one and then you improve, very roughly said. But opening up the cell as a black box, you increase your abilities to improve your drugs and personalize your drugs. And then I'll leave out the last one in view of time. So surface functionalizations, lots going on. We've seen already some of that going on. This is an existing chip, by the way. This is a microchip, but the processes on there, which are DNA recognition, and so that you can scan a whole set of DNA patterns in one time. This is, for instance, used in cancer research, an Affymetrix chip. On the right side, you see stuff that you can do with single molecules, just testing of a certain molecule is somewhere on the cell wall or whatever you want to check. So basically, this all opens the road towards good diagnostics, parallel, massive parallel, low concentrations. And, oh, this one should be behind the other picture. This is a picture of something massive parallel. The other thing is lab on a chip. The chemical laboratory shrunk down to chip size, throwing around little bits of liquid there and making them react and measuring something. When you have a lab on a chip, you can integrate that with a cell and look into the cell. Have a little gadget going in there, drawing out some liquids or feeling something that's in there or manipulating something that's in there. Changing the environment of this cell by adding a pharmacological agent and seeing what's happening in there, seeing, the whole game. So this is a very important thing that's going on at the moment. Then we go into targeted drug delivery. That's the second chapter of the European Technology Platform. The next speaker will go into drug delivery a lot more. I just go through it fast here. If you look at the reasons why to work with nano-sized particles there's a number of increasingly fancy reasons to do that. First of all, if you have very small particles, you can create a much larger surface area so that you can make it easily being taken up by the body, bioavailability, solubility. You could also try to protect that drug by, for instance, making a little shield around it so that it can pass the stomach and then fall apart and be, taken up by the body in the bowels. So protecting the drug or protecting the person, and then go into the last one. If you want to accumulate a drug at a given site, you can sort of make a vesicle with markers or molecules that recognize something on that site. So it just stays there. It's like when you have a central heating system, you put a magnet in someplace, and then you inject some iron particles somewhere else. Well, if you wait for some time, all the iron particles will be on the magnet. That's what's happening there. And then you can protect the person from the very harsh drugs that he or she might need to use, and release them at that given site, so they have much more impact on the organ there, and not on the rest of the person. And tailoring release patterns. You can put stuff inside a matrix and slowly have it released over longer times. There's a lot of work going on in there. So those are a whole set of things. They also allow pharma industry to open up new routes to do stuff and continue basically continue their way of money making. Well, going back to let's say the micro technology here. I thought I'd put in this thing because this is what struck us when we worked with a company, NanoPass, which is an Israeli company. It doesn't work anymore. Got this from the ministry, so it stops working all the time. NanoPass. And they wanted to create something that goes through the skin but doesn't touch the pain nerves, which are a little bit deeper. So it feels like sandpaper, but it does reach the parts in the body where there are fluids. So you can put stuff in there or get stuff out. Oh, thank you very much. So that's what they do. They put stuff in the body, and one of our companies takes stuff out of the body and tries to measure it. But basically, when they came to us and asked us, can you make something like these nano needles or something, or micro needles they were called, we thought, well, that's stupid, it's all technology, do something more fancy. But the problem with nano is that often, by the micro or nano, by the time you see the application, you might be able to inject old technology or whatever. The trick is not the fanciness of the technology, the trick is to find the relation between an application and a new or old technology. That's the big issue here. So the motivation behind this is of course very clear. Even clowns don't help. So you make these little needles. It was a one-step process, very, very simple. And they now use that, and we are ourselves making the blood samples and adding a little chippy with that and basically measuring. This is one of our latest startups that measures lithium in bloodstreams. And that's a manic depressive disorder or bipolar disorder drug that needs to be kept within very narrow limits. So and because I want to go into basically into the preventive health later on, another issue that used old-fashioned technology, just making holes in a membrane, was the pulmonary drug delivery. This is, the stuff you breathe. And up till now, there have been some asthma agents that you breathe, but people want to have glucose go in there and other stuff, because it's a great way of getting drugs into the body fast without having to, go through the skin. So that's another industry that is confronted at this point with a disruptive issue going on with companies like Microparts and our own MedSpray company, that these people control the droplet size exactly so that you have most of the drug going into the right places of the lungs, not into the bronchi and other places where they cause a lot of side effects that you don't want. So this is one of the things but the trick here is just making holes. By the time this company came to us with this idea, we were able to make holes for 15 years. And, we never thought of this. That's something I want to stress. Often not the fanciness of the forefront of the technology will show you the greatest breakthrough applications. They might be further away to the back. Then the whole area of tissue regeneration. There's a whole area there that tries to rebuild stuff that doesn't work anymore. And at the moment, there's a lot of bone replacement stuff going on. And of course, people are looking into cartilage replacement. People are looking into, of course, the pancreas and stuff like that. There's a lot of stuff going on in there. And there is interesting progress being made. This is, in some areas, at least in the European agenda, seen as one of the nanotechnologies. And of course, there's a lot of biology in there, but it is connected to dead materials, artificial materials. That's why we look at it that way. Basically, stuff like that looks like this. Yeah, this is an in vitro approach where you have a sort of a base material and you have some cells on there. You let them just grow the whole thing full. Then the scaffold disappears. It sometimes dissolves after you've put the whole thing in the body. So you sort of replace, you help the tissue find its structure again. Well, the whole area of vesicles and drugs and targeted drug delivery has to do with, let's say, emulsion type of things, little micelles or little fatty shapes, or like bilipid membranes, vesicles that are in a stream, in the bloodstream or anything. Well, emulsions are all over the place. Many products like ointments or paint or emulsions are everywhere. Now, this is what we find very interesting. Of course, Holland is also a food country. You might know Wageningen University, which has been an outstanding place to do food research. And they're into life sciences now. They're doing a lot of stuff there. But the interesting thing here is that we bring these technologies to them, and together we make weird things. We thought, this is, again, just making holes. It's now 20 years ago since we could make holes, and still we find these weird things. This is a company called Nanomi, and they make little droplets. So they have a perfectly controlled emulsion, which is very, very stable. Always good for the food industry. But it's even better because they can make double emulsions, which is basically a thin shell of fat with water inside. And then you have your whipped cream or your milk tasting like full milk with the energy content of less than a low-fat milk. That's interesting. That's a whole product area for this food company. So they're really excited. And then at some point you put in those things you want to add to the food, but that taste bad, like some of the vitamins. You just put them inside. And that's not a difficult job to do, because once you control the flows and the way these little globulines are formed, that's a continuous process. It just runs on and on with a pretty high throughput. So, to wrap up, what I see happening in the short terms is, of course, the simpler things that have a shorter term to market, the materials and the surface modifications that are used directly in the market. Then there is, of course, the whole area of instrumentation that is important, because instrumentation is used to diagnose or to research things. That's always early. They have a high degree of innovation going on in there always, because if you can find with a 2 or 3 or 5 times higher accuracy if that protein is in that body fluid, you'll buy the machine basically. You'll find someone to buy it for you. So, and then there's the analysis subcell level, which I see happening already and pacing up. So that's and drug delivery systems in general. And other stuff is later on, because there's a lot of more system approach, and we already talked about that. The targeted drug delivery area, of course, has issues with regulation that is not fit to adopt these new type of drugs yet for a part. One thing I want to stress here is that if you, as a company or as a young startup, the parties you want to work with, and you need parties that have a strong research culture that supports good nanotechnological research. There's some nanotechnological research that's very disciplinary focused. For a company, that might in special cases be good, but in general cases it's less of a fit, because the world of a product is a multidisciplinary world. And also because you're trying to speed up the learning curve of commercialization, the research part has to have a keen sense of commercialization issues, of what's going on in the world of a startup company. Okay. So I go to my last slide. If you look at where we put our money, it's a lot on interfacing. You know, that's where it happens. There's a lot of technology on the dead side, I always call it, on the side of the artificial stuff. There's a lot of technology and knowledge of cells, biochemists, biomolecular scientists. But the interface, that's where they meet. And if you put your money there, that's where you get the fastest moves ahead. And then there's the complexity issue that we don't seem to get a good grip on yet. No solutions there, so wait with the money till you see something good happening. And then, of course, the program level, the management of the innovation process. For us, it's a key issue that as a research institute, even a university research institute, you have to have policies and cultures that support cooperation with these startup industries. Okay, that's what I wanted to add to this stage from a nanomedicine point of view. Very broad, but we'll wait with questions till the next speaker, isn't it?
We'll wait for questions. Yeah, till after Michael's, there's Michael. Thank you so much.